The blueprint for life: nutrition in the first 1,000 days. In the world of public health, there is a critical window of time often referred to as the first 1,000 days. This period spans from the start of a woman's pregnancy up until her child's second birthday. The nutrition received during these $1,000 days is the single most important factor determining a child's long-term health, growth, and cognitive potential. This script will break down why this window is so crucial and what steps should be taken to optimize it. Section 1. Nutrition during pregnancy. Laying the foundation. The mother's diet during pregnancy directly supplies the building blocks for the growing fetus. This is when the foundations for major organs, including the brain and spinal cord, are established. Two micronutrients stand out as non-negotiable during this phase. Folic acid, essential for preventing serious birth defects of the brain and spine. Neural tube defects. Supplementation should ideally begin before conception and continue through the first trimester. Iron, necessary to support the mother's increased blood volume and to prevent anemia, which can lead to premature birth and low birth weight. A balanced diet rich in protein, healthy fats, and a variety of fruits and vegetables is crucial. But targeted supplementation, particularly for iron and folic acid, is often required and should be guided by a healthcare provider. Section 2. Exclusive breastfeeding. The perfect start. For the first 6 months of a child's life, there is no substitute for breast milk. Organizations worldwide unanimously recommend exclusive breastfeeding for the first half year. Breast milk is dynamic. It changes composition to meet the baby's evolving needs. It contains the perfect balance of fats, proteins, and carbohydrates. Crucially, it is packed with antibodies that protect the infant from common childhood illnesses like diarrhea and respiratory infections, significantly boosting the child's developing immune system. Furthermore, the physical closeness during breastfeeding supports essential mother-child bonding and attachment. Section 3. Introducing solids. Complementary feeding. Around 6 months, a baby's nutritional needs exceed what breast milk alone can provide, making it time to introduce safe and appropriate solid foods, a process known as complementary feeding. This transition must be handled carefully. The key principle here is variety and density. Foods introduced must be rich in micronutrients, particularly iron and zinc, as the baby's stores start to deplete. Start with pureed iron-fortified cereals, followed by soft fruits, vegetables, and protein sources. It is important to introduce common allergens safely, one at a time, under guidance, to prevent later food sensitivities. Avoid sugary drinks, excessive salt, and highly processed foods entirely during this stage. Conclusion: the lifelong investment. The $1,000 window is a one-time opportunity. The nutrition received now has lasting consequences. It influences cognitive development and educational attainment. It reduces the risk of chronic diseases like diabetes and heart disease in adulthood, and it ensures a child reaches their full physical height and potential. This is an investment that pays dividends for a lifetime. Therefore, every pregnant woman, every new mother, and every family member has a shared responsibility to prioritize optimal nutrition during this vital period. If you have questions about specific dietary plans or supplementation, please consult your pediatrician or a certified nutritionist immediately. The health of the next generation depends on the quality of the foundation we lay today.